It's been nearly 2 weeks since the transition nationwide to the new 988 Suicide and Crisis Lifeline. Now, texting or dialing those 3 digits, 988, puts callers with suicide, mental health, and substance-related crises in touch with trained professionals. This 988 Lifeline is a network of more than 200 call centers like this one you see in Maryland. All of this, a federal program, the U.S. Department of Health and Human Services, working, though, with states and local places as well. The hope is 988 will make it easier to reach out for assistance and, in turn, save lives.
So when an individual calls, texts, or chats to access 988 services, they will be connected to a trained crisis counselor who will be able to provide support, to listen to what their concerns are, provide stabilization services, de-escalate the crisis, and then provide linkages and referrals to ongoing supports and services. We know that in most cases that contact alone can be life-saving and can be enough to provide stabilization for that individual in crisis.
This shorter, simpler number, 988, is an opportunity to transform how we approach crisis situations and suicide prevention. The 988 Suicide and Crisis Lifeline launched on July 16th. In the first week, the Substance Abuse and Mental Health Services Administration says the total response volume increased by 45%. Here to tell us more about that is John Draper. Dr. John Draper, he is the Chief 988 Lifeline Officer from Vibrant Emotional Health, a New York nonprofit that runs local community mental health programs and manages crisis contact centers nationwide. Welcome. Thank you for your time today, Dr. Draper.
Good to be with you.
You too. Let's talk about this. How do you characterize the numbers from the first week of calls, the increases in texts and chats from the first week for this 988 Lifeline?
Well, it's working.
Yeah.
In fact, it is easier to remember and therefore easier to dial as well. We are seeing a huge impact in terms of 96,000 people that were helped in the first week relative to exactly a year ago. That's about 66% increase. The 45% increase was just from a week before. So we're going to continue to see these numbers rise over the coming months and years to a point where we're going to be able to access more people who are in suicidal and mental health crisis nationally.
So we're talking about going from that 10-digit number to, again, 988. I'm going to say it a lot during this interview because I feel so important, 988. So with this increase, can you give us, I know, personal information, but just understanding, is it younger people, pandemic issues, school issues? Do you have a sense who's reaching out more?
It's pretty early to tell. Again, phone, text, and chat, we tend to see younger folks accessing the phone or the text and chat. They still actually phone as well, but there's a lot more of a higher proportion of younger folks who are accessing text and chat. So I'll be curious to see when school starts if we see even higher numbers for those individuals who may, again, be experiencing academic stresses when they start. But mostly I think that the reason we're seeing a huge increase now is because there are people who are hearing about the number and some are hearing about the number for the first time. I wouldn't say that there's more people in crisis now. I wouldn't say that there's people with different types of problems that are calling. I would say it's mostly a matter of public awareness and also, again, easier to remember and easier to dial number.
When somebody calls 988, what happens? Who answers the phone?
Well, there are thousands of crisis counselors across more than 200 centers around the nation who've been providing services for decades in these communities. When you call the Lifeline 988, you'll get a trained counselor who knows about these standards and practices, but really wants to know you and learn about your problem and understand you, connect with you, listen to the situation, problem solve with you in a collaborative way, and then help you take care of yourself. It's really mostly about how do we get you to use your internal resources and the people around you to get through this crisis? Often people are going to need additional resources. We can make referrals and connections in the community and do so often.
You know this personally from your experience setting up LifeNet in the aftermath after the tragedy of 9/11 and just, you know, everything people have and still are dealing and coping with. Can you just talk about follow-up with the 988? How do these relationships, connecting them with professionals, what happens?
Well, follow-up is really important to the extent that a call, yes, can make a difference. And about 90% of the time, we can de-escalate a crisis over the phone. But that doesn't mean the person may not need additional resources or additional support after the call. So sometimes, whether it is making referrals and checking on them, and obviously we ask for consent. Would you like for us to check in on you and see how you're doing afterwards? But especially people who are at higher risk. And we've found through research that follow-up calls have made a difference in keeping people alive, keeping them safe, and also keeping them connected to other people and to care.
The last thing I want to ask you about, I mean, during the heat of the pandemic, through now, we've heard sometimes, just in general, not calling an emergency number. It can take weeks to schedule an appointment. Are you hearing this too?
Well, it's going to take a long time for the behavioral health care system to have the kind of resources necessary to be able to manage all of the demand out there. And even if we had all of the people who needed care go to seek care, they wouldn't necessarily get it for quite some time. So it's really important to have a stopgap measure, this 988 crisis service, that is going to be there for everyone until those resources are built out. We're also very interested in making sure that there's a continuum of care, that there are mobile crisis teams that can come to individuals who are too sick and unable to go get care in the community, and that there are also crisis stabilization services, kind of urgent care services for mental health, like an emergency department without the emergency department boarding, and you're in and out in a much shorter period of time. Those kinds of community services we need to build out over time. Will take some time, but in the meantime, hope has a new number with 988.
I was going to say there is hope and there is help. Dr. John Draper, thank you so much for joining us. This is just life-saving and so vital, and we'll spread the word here. Thank you.
Thank you for having me, Dan.
You're welcome. Dr. Draper is the 988 Lifeline officer from Vibrant Emotional Health. If you or a loved one is struggling or in crisis, help is available. You can call or text 988 or to chat, go to 988lifeline.org. We have that information on our website, cbsnewyork.com.